Good afternoon, everybody. My name is Kefa Bosire from University of Nairobi. I had hoped to make this presentation at the MEPI conference in Harare, but unfortunately, I wasn't able to get on to this opportunity. But I thought I could share my thoughts and experience from University of Nairobi, and hopefully others may be able to view this presentation that I prepared. So my story is to explain or to describe our experience as University of Nairobi in developing a new model of training for the nursing profession that was supported by the MEPI initiative. And this initiative involved a partnership between the University of Nairobi and Amref, which is an international NGO that's based in Nairobi. Amref has had a lot of experience in training nurses using distance learning and e-learning, and so University of Nairobi took the opportunity to work with Amref, and we established a partnership targeting to improve the quality of care by training nurses, upgrading them from the diploma to the degree level. And we wanted to explore the use of the model where students would come to the city for a very short time and spend most of the time learning while they're working at their sites. So the concept is based on a belief that the quality of care is greatly related to the quality of the nurse you have at the site. And so we hope that by improving the quality of the nurses who form the backbone of healthcare in Kenya, we would have a tremendous impact on the quality of the services that our people receive in the rural areas where most of us stay. So at the back of our minds, we had this challenge. Most people still have this uncertainty about the quality of training that can be achieved using distance learning. And so there's always the risk that people may be afraid to shift to this new model. And so the challenge is, we stay where we know, or do we try a new and not well-trodden path? And so this is the risk we chose to take as MEPI at the University of Nairobi. Now, there were certain considerations that we had to make, and amongst this was that there were technological factors. We do not have power and electricity in all locations, and neither do we have internet connection. So we had to devise technology that would work with limitations in these settings. We also had to take into consideration the challenges of running partnerships, and indeed the partnership between University of Nairobi and Amref would have been a challenge. So we thought maybe that's something that we might need to think about. And how about internal support? To what extent would University of Nairobi be comfortable to engage in a partnership to roll out its academic program through a private sector organization such as Amref? Then what would the regulators react? How would the regulators react to this partnership? What is their take of such a partnership for training nurses? And what support would we get from the leaders in the health institutions that we hoped to partner with? That still remained grey. But bottom line was, what would it cost? That was a serious consideration that we had to take into consideration. So which way then? Which way would we go now? Putting together a public institution and a private institution, and hoping that somehow they would get to work together. And so the challenge was, how was this going to work? Because it has been tried before, but the success of such a venture has not been seen. So it's always we've observed the experience where you have great ideas and great plans, and sometimes it's a little tricky when it comes to implementation, and the outcomes may probably be different from what you had in the draft. And so here is one situation where we had some experience and we had the desire to try to take the risk and pull the two institutions along and see if we could achieve this dream. Well, because there was no experience before, this was like working with the barest minimum dashboard and making a journey into the unknown where there was no road. And so this experience was nerve-wracking right through the 3 years that we have worked to have this program up and running. And definitely it has had an impact. It has eroded away things that we thought could not change. It has moved things that we thought could not be moved, and it has established things that we hadn't fathomed would be possible. And one of the things is that it has changed our thinking on financing training and how we can cost training. And it has also had an internal change. University of Nairobi now can see that it's possible to work in partnership with organizations and deliver quality training. And we have developed new relationships. And I think that's the most wonderful thing about this, that we have built relationships with county governments. We have built relationships with institutions. We have built relationships with in charges of facilities. And so there's been a tremendous growth in the network that has supported the training. And so how did we get this done? One of the important things is to ensure you have get stakeholders involved at a very early stage, and we kind of took advantage to get that, and then finally getting the first cohort enrolled. That was pretty important as our target. So one of the key things that I would like to highlight is that for e-learning or blended learning to be successful, learner support systems are the most important element. And what do I mean by this? I mean the mentorship systems, the systems that enable students to get guidance every day away from your facilities or from your primary institution site. So setting up mentorship systems is important, and we invested heavily to get the mentors trained in our program, and then putting in place computers and computer labs in the sites that we hoped our students would be attached. And these were actually public health hospitals that are distributed around the country. And we're also working currently to ensure that we provide their resources on tablets, which we are currently procuring. And so this should be mobile learning shortly. By the end of this year. So what have we been able to achieve again? Having engaged the county leaderships, we're able to roll out this program to 29 sites in the country. And we have also been able to get institutional managers involved and get their support to get both people allowed to come for the training and those who come for training supported through the time that they will be having clinical mentorship. And so, as you can see, this is fairly well distributed across the country, where the green dots are where we have the main schools, and we hope to build more centers across the smaller blue dots. So this has put in place a new training model for the University of Nairobi, and we refer to it as a Module 3 training that involves a partnership or the utilization of a partner beyond the University of Nairobi to host the program and help manage it. And there are several advantages to this, because there are shorter turnaround times for very many things that would normally take longer in the mainstream institution. Now, staff are definitely learning new things, and they're learning how to teach using new models, and this is an excellent experience that I think MEPI has brought forth for us. The other thing is that we have built a network of new relationships that can foster training beyond MEPI. And I'm happy to say that from an enrollment of a standard between 40 and 50 students a year in the regular program, this initiative has increased that enrollment to about 80-90 students twice a year, which is about another 160 to 180 students added to the 50 every year, which is like a fourfold increase in the intake of our students. And I'm proud to say that we now have over 450 students over just the past 2.5 years enrolled in this program, and we expect to have the first cohort graduate proudly this year, finishing their training by August, September this year, and graduate this year, December. So we are proud to look forward to this graduation this year, and all this thanks to MEPI. The other things probably I would like to say is that we may not have broken records, which is probably a tradition of Kenya on the athletic field. However, we are lucky and we feel that MEPI has given us a great opportunity to deliver concurrent training while giving while people are at practice centers. This is really tremendously enriching the methods we use for training nurses, and they're able to continue to be with their families. They do not need to leave the rural areas to come to the city for full-time courses as was previously done. And then the presence of trainees is expected to improve the quality of care at the institutions they work, because they will be of higher caliber, and we think that their level of interaction and management of issues will be different. And we hope that this model can be adapted for other cadres. And I wish to thank all the partners, including University of Maryland, Ministry of Health and its devolved institutions, and the Nursing Council of Kenya, and definitely NIH for having supported this grant. Thank you very much. And so we look forward to the road. We look forward into the future, and we see this great opportunity to do wonderful things using such initiatives. So thank you, everybody, and thank you for taking time to listen to my presentation.